Ma'am, you can start.
Hi, everybody. Good evening. So in today's class, we'll be discussing about the chapter of identification. So now we are in the 21-day revision series where we'll be focusing on the most important topics that have been asked in the previous years. And these are the questions that are most anticipated in your coming exams. So without any ado, we'll start the class. Coming to the important questions that we'll be discussing today, mostly these are all the short essays that we'll be discussing today. And coming to the questions, we'll be discussing define dactylography and discuss the types of fingerprints and its medico-legal importance. Second question is comparative techniques used for identification. Then we'll be studying about tattoo marks and mention the dyes used to produce it and what are the techniques to erase these tattoo marks. Cephalic index will be the next question. Then we have medico-legal aspect of age, medico-legal aspect of hair, corpus delicti, discuss age estimation of teeth by using Gustafson's method and Klinefelter syndrome. So all these questions that we'll be discussing today are from the chapter of identification. Okay. And remember, even though identification chapter is very vast, if you open your Narayan Reddy, it is going to cover like around 50 to 70 pages. But remember, most of the questions that come from this chapter are the 3 markers, are the short essays. Okay. Now, coming to the app, why choose Auricle? Because Auricle is a platform where you get multiple things in a single platform. For example, we have the recorded classes, live classes, practical session, exam module, as well as hard copy book set. So these are the various resources that you can use to prepare for your exam. And all of these is available for you in a single place. That is where Auricle stands in the upper hand. Coming to the recorded classes is done in such a way that every topic, no matter how small or how big, is given equal importance. And here our aim is to make the subject crystal clear with the students and to make the students doubt-free. Okay. So here we are going to offer you a flexible learning atmosphere where you can access the foundation classes anytime, anywhere, and you can revisit these topics any number of times, and you can enhance your understanding and retention of the subject. The expert instructors here, as I told you, are going to guide you through the simplest of the simplest topics. Here we are focused in making the subject concrete with all our students. So this platform is also going to be very convenient for you to revise because, as I told you, you can revisit these any number of times. In case you have a doubt or if you feel like you've forgotten something, you can definitely go back to the videos and watch those videos. Coming to the next feature Auricle has to offer you, we have live classes. So these live classes are going to give you in-depth coverage of the most important topics, especially the past 10-year PYQs. And these are the questions that are most anticipated in your coming exams. Here, the educators not only will tell you about how you have to approach these topics, but will also clear all your concepts, will give you tips on answer writing skills, will give you study plans, and so many more. These are going to be interactive learning where children can participate, they can get their doubts cleared. They're going to be MCQ polls in between so that it is going to be an active way of studying rather than the usual passive way of studying. We also guide you through Viva VOC and so many more. Totally remember that live classes are going to be interactive sessions. Next, we also have Express Exam Module. So these Express Exam Module are curated in such a way that the entire syllabus is going to be covered in less than 20 hours, and this holds true for every subject that there is. Not only forensic medicine, every subject, any bigger subject like, for example, surgery or medicine is going to be covered in less than 20 hours. So here we aim to make you understand the most important topics. So there are certain topics which are like 3-star or 5-star, okay, which are very important and you cannot miss these before going to exam. And just before exam, when time is a constraint for you, you can go through this Express Exam Module where we will guide you through the most important questions. There are certain topics that are no miss before going to exam, so we are going to guide you here. We will also give you answer writing skills. We'll also tell you what diagram to put for each question, what flowcharts to incorporate in the answer, and how can you effectively write your answer so that you get extra marks. Here, the expert educators have a lot of experience and they're going to guide you through this. So there are a lot of students who are very good, okay? They know the concept very well, but they fail to put that on paper, therefore get less marks. So in order to help those students, we are here. We also have one-to-one doubt clearing session. So this session is going to offer a student-centric approach where every question, no matter how small or big, is valued and addressed with the dedicated educators, giving you a comprehensive understanding of all these topics. Personalized attention is given to each and every student so that their doubts get cleared. And it is going to be a safe learning environment where student, without having the fear of being judged, in a supportive and understanding setting, can study and get all their doubts cleared. So there are a lot of students who I can tell are really shy in the class. Even though they have a doubt, they may not stand up and ask a doubt. Okay, that is true for most of students, but they might have certain hidden doubts in them. And here in this platform where we clear the doubts one-to-one, we are going to solve all those doubts of yours. We also have hard copy note set. So coming to the Auricle's hard copy note set, these notes are in a very colorful manner. So it is going to give you a picture skew memory. It has lots of images, flowcharts, and flashcards so that you can retain all these very easily. Then we also have QBank. So our QBank is an updated and highly effective QBank where we have 3 levels of expertise. So coming to the 3 levels, it goes from beginner up to expert level. And usually students are advised to start from the beginner level. And once they finish the beginner level, they can go to the next level and then to the expert level. Once the students find it very easy to solve all the questions from the expert level, that means they have mastered the subject and there is no looking back. And one very good thing about the QBank from Auricle is that it is a customizable QBank, meaning you can put the questions that you are studying. Like for example, in forensic medicine, if you're studying the topic of asphyxia, you can search the questions only from asphyxia and solve those, so that it's going to be an active recall of whatever you have studied. Okay, and these MCQs are going to cover questions from the prof exam, NEET, PG, as well as FMT. We also have practical sessions where we give you hands-on experience, and we're going to engage all the students in interactive sessions that are going to simulate real case scenarios. Okay, so usually what happens, there is going to be a bridge between when practicals are taught in the college and when you actually have to go and give practical exams. And in that bridge, you are so into your study holiday, studying for your theory, and at times what happens, you forget whatever practicals was taught in your college. So this happens with every medical student, and to bridge this gap, we have come up with Auricle's practical sessions where we give you expert guidance and hands-on experience on the various clinical scenarios that can come. We're also going to guide you through the Viva VOCI that is there, and also we will be giving a special interest on the spotters, because spotters is something that is there in every chapter, and covering that would be a very daunting task for the students. So in this platform, we are going to cover all these spotters at one place so that your learning experience becomes much more easier. Now, coming to the various subscription plans that are there in Auricle, we have the foundation plan, advanced learning plan, complete learning plan, as well as the ultimate MBBS plan. Coming to the foundation plan, it is for a period of 3 months where we are going to give you pre-recorded classes, live classes, express exam module, practical session, and QBank. And all these things are available for you for a period of 3 months. The next plan is the advanced learning plan, where you have all these things, the pre-recorded classes, live classes, express exam module, practical sessions, and QBank, which is available for you for a period of 6 months. And when all these is available for you, along with hard copy note set and one-to-one doubt clearing session. Remember, notes and one-to-one doubt clearing session is going to be an add-on for you in the complete learning plan, which is there for a period of 1 year. Then, if you have all these things available at your fingertips for about 4 years, that is through and through your MBBS, you're taken care of, then it is the ultimate MBBS plan. So you can use my coupon code Dr Prashi kaveri 20 to avail additional discounts on your subscription from Auricle. Now, coming to the topic per se, as I told you, we'll be discussing the topic of identification. So before I go through and explain you the questions from this chapter, remember, from the chapter of identification, number 1, you're mostly going to get either 3 marker or 5 marker. So while studying also, you make sure that you study in that regard. Even though the chapter is very big, as I told you, it is going to cover 70 to 80 pages of your textbook, but it doesn't have that much weightage in your actual theory exams. So study accordingly. This is number 1. Number 2, So in each of these revision classes, I'll be giving you pro tips, as I told you. And in yesterday's class also, I've given you certain tips. And in this class also, I'm going to give you certain tips. Now, usually in the paper, you're going to have 2 10 markers. And then you're going to have around, so this is going to be around how many marks? 20 marks. Then you're going to have around 10 5 markers. So when you have 10 5 markers, this is going to give you how many marks in total? It is going to give you around 50 marks in total. So you are going to have 10 5 markers, which accounts for 50 marks. Then you have around 10 3 markers, which accounts for 30 marks. So together, 20 plus 50 plus 30, it is going to be 100 marks. This is how your usual paper is going to be divided. And this is the same pattern for most of the medical colleges, except for 1 or 2 universities. The number of questions might be different, okay? Because you also have your MCQs added. No? So in RGUHS, that is the Karnataka's university, they have MCQs. That is, they have 10 mark worth of MCQs. But in some university, it may not be there. So it can be little individualistic. But let us take this example, what I have given you initially, and let us see how you have to make up your mind to answer this question so that you do not have time shortage. Okay. So now, as I told you, usually the exam is going to be there for how many hours? 3 hours. So 1 hour, 60 minutes. So how many minutes is in your hand for 3 hours? How many minutes? You're going to have 180 minutes. So in 180 minutes, you have to answer so many questions. And sometimes if you give a lot of your time to answer 5 marker or 10 marker, it becomes difficult for you to answer 3 marker. And 3 marker, as I told you in the previous session also, it is a mark scoring thing. So how should you divide your time? For a 10 marker, always make sure that you just give 10 minutes. Or at the max, you can give it only 20 minutes. This is how you have to frame your mind. So now, imagine at the max you're giving it 20 minutes. So it is going to cover 40 minutes. So in 40 minutes, no matter what, you have to finish your 10 marker. So initially, when you start writing, imagine you start with the 10 marker. Your mental frame should be that you're going to finish it in 10 minutes. So imagine your exam starts at 10 a.m. You have to finish it in 10:10. Or in case you cannot finish it at 10:10, remember that your next bell is 10:20. That is a 20-minute time frame. So when it is 10:10, you start writing your answer faster. So by 10:20, you have to finish your first question. And by 10:40, you have to finish your second question. Imagine you have not finished. What are you doing? You're just going to leave it there and start with the 5 marker. Because at the end, you're going to have some spare time where you can come back and fill these details. Okay. Now, for a 5 marker, how much time should you give? You can give it only 5 minutes. Or at the max, you can give it how many minutes? You can give it around 8 minutes. So you have to be prepared in such a time frame so that it becomes easier for you to answer. So how many 5 markers are there in your paper? There are around 8, no? There are around 10. So 10 into 8, it is going to be 80 minutes. So how much is 40 plus 80? How much does it come to? It comes to 120. So you have finished 120 minutes. How many minutes are remaining? So you have around 60 minutes remaining. That is by this time. That means in 2 hours, you're supposed to finish your 10 markers as well as 5 marker. Okay. After this, here also, as I told you, if your exam starts at 10 a.m., by 10:40, you're going to finish the 10 marker. At 10:40, you're going to start the 5 marker. And if you're taking 80 minutes, when will you be finishing that 80 minutes? That is at the end of 2 hours. That means by 12, you are going to finish your 5 markers as well. Now, what is remaining? You have the 3 marker remaining. For each 3 marker, remember, you are going to give only 3 minutes. Or at the max, if you're not able to finish it in 3 minutes, you are going to give it 5 minutes. So there are 10. So 10 into 5, how much? It is going to account for 50 minutes. So totally, now how many minutes are over? 170 minutes are over. You still have another 10 minutes where you're going to go back to your answers. And in case you've left some point, or if you feel like you can add something, or this is the time where you have to, you have to take your pen and you have to color those boxes where you have answered the question. You have that system. So you do that coloring part. You check whether you've written your name properly or whether you put the proper question in the proper page. So all these things should be checked in that 10 minutes. Got it? Only if you keep your mindset in such a frame where I am going to fix this much time for each question, only then it is easier for you to answer. Otherwise, Imagine it is a 10 marker question, and usually for a 10 marker, it is usually the entire chapter that is going to be asked a 10 marker, no? And obviously, you know a lot, you will write, and later you will realize that you spent some 30 to 40 minutes in the 10 marker. And imagine for 10 markers, if you have spent like 1 hour 15 minutes, definitely there is going to be time shortage for you to answer 5 marker or 3 marker. And for 10 marker, as I told you, the maximum mark that you get is only 6 or 7. Or in case you write it very beautifully, you might get 8. Okay, but in 3 marker, you can get out of out. If the points are proper, you will be getting 3 on 3. Therefore, it is very wise for each and every student to focus on 3 marker and to manage time so that you can get enough time for the 3 marker. If you want, you write down this plan somewhere and you fix in your mind that you're going to follow this. Otherwise, it becomes very difficult for you to answer everything on time. Okay, I hope you have understood whatever I've told right till now, and I believe this is going to help you like anything in your exams. Now, coming to the chapter of identification, let us discuss the important questions. Okay, number one question is about dactylography. So they're asking you the definition of dactylography and discuss the types of fingerprints. Okay, and its medical legal importance. Now, what is dactylography? Dactylography is a study of fingerprints as the method of identification, and this dactylography has certain other names like dactyloscopy and also the Henry Galton system of identification. So, in your exam for a 3 marker, it will just give you Henry Galton system of identification. Remember that we are talking about dactyloscopy. So, dactyloscopy is a study of fingerprint. It is a process of taking the impressions of the papillary ridges of the finger. So what are the papillary ridges? These that are there in the dotted lines. No, these are the papillary lines that are there in the fingers. So we are taking their impression. Okay. And why is it used? It is used to identify a person because this fingerprint is going to be unique for each and every person. That is how we can identify the person. Identification method is absolute without any chance of error. Okay, because even in identical twins, they're going to have different fingerprints. Therefore, we consider this as an ultimate type of identification. So what are the basics of dactylography? So these dactylography, the fingerprints are going to be very unique. Usually there are 4 types of fingerprints, okay? So let us see what are the 4 types of fingerprints. We have whorl. So what is whorl? As you can see in the image here, whorl. What do you understand by whorl? A whorl of flower. It's going to be there in a circular manner. So this is called as whorl. So if fingerprint is there in the form of this, it is called as whorl. Then we have another one which is called as loop. So what is loop? Loop is going to look like a banana shape. Okay, and in loop also we have 2 types. Number 1, it could be a right-sided loop. Number 2, it could be a left-sided loop. Then we have arch, like the temple arch. No, it is going to be arched towards the end of the finger. This is how an arched fingerprint looks like. Next, we have composite. What's composite? It is going to be a sum of everything. That is, it is going to be a combination of whorl, loop, as well as arch, and it is found in very little amount of population. So these are the 4 broad category of the type of fingerprints that is there in the people. Now, what are the basics of dactylography? These are going to be unique for each person. Ridge pattern in the 2 finger differs and it can never be identical in the 2 persons. As I told you, it is going to be very unique for each and every person. Even in identical twins, they are going to have different dactylographic fingerprint. And these are permanent. That is, once formed, the ridge pattern in an individual never changes except for the size. That is, as we grow big, as the skin expands, as the tissue expands, by size-wise, it can grow. But the pattern is going to remain same from birth until death, unless or until it is mutilated, for example, by leprosy or by a burn, by a scald. Only then there could be some changes. Otherwise, it is a relatively permanent thing. So what are the different types of fingerprint? As I told you earlier in the image, we have loop, we have whorl, we have arch, and we have composite. As I told you, composite is a sum of all the 3 types. That is loop, whorl, plus arch. And it is there in very less amount of people. That is, it is seen only in 2 to 3% of people. Whorl, it is this. It is a flower-like arrangement. It's a circular arrangement. Whorl, it's seen in around 25% of population. Arch looks like this, like the arch of a temple. It is seen in around 7% of people. Loop, that is all the fingerprint loop towards the right side or towards the left side. And this is what is seen in majority of the people. So now I want you to do something. take your fingers and see what kind of fingerprint do you possess. So it can be different in each of the fingers as well. Okay, so I have loop in my first finger, I have arch in my second finger, I have arch in my third finger, loop in my fourth finger, and loop in my fifth finger. So when you try to do this, you're going to remember how the different patterns look like. Okay, so it's a simple exercise that I want all of you to do. Now, there should be around 10 to 12 points of comparison, which are fine in nature, and that is the proof that is accepted as proof of identity. So, in order to say that the particular fingerprint of a person is like if you have a fingerprint on a paper, and imagine that is of a person A. In order to say that this exactly matches with this live person, you should have around 10 to 12 points of fine comparison that matches between both. So these patterns are not inherited. That is, by looking at the parent's pattern, you cannot say whether the child is theirs or not, because it is not inherited. Therefore, paternity or maternity cannot be proved. How else can you prove paternity? You can do a DNA analysis or DNA fingerprinting in order to prove the paternity. Okay, and as I told you, even in identical twins, the pattern is going to be different. Coming to the next question, comparative techniques used for identification. So there are a lot of techniques that can be used in order to identify. They're asking what are those techniques. So imagine it is a 3-marker question, okay? They're not really asking you to explain everything. At least you have to be able to name 4 to 5 types of comparative techniques. And if you're able to explain, 1 or 2 lines about these, well and good, but at least you'll be able to give the names of certain comparative techniques or what are you looking at these techniques, okay? So these comparative techniques are used for identification in the various fields such as biology, forensic science, and linguistics. So you can use these comparisons a lot of things, okay? Now coming to the first type, it is morphological comparison. What do you understand by morphological comparison? Analyzing physical characteristics such as shape, size, structure to differentiate species or objects. That is, now when we talk about humans are going to look in a certain way. No, they're the vertebrates who are going to have a face. They're going to be standing erect. There's a particular way. So when you look at a monkey, it looks in a certain way. If you look at the animal, like for example elephant, you know how it looks like morphologically, or you're very aware of the external features. No? So by looking at the external features, by looking at the shape, size, or structure, if you're able to differentiate, that is nothing but morphological comparison. Next, we have genetic analysis. What is genetic analysis? Comparing DNA sequences to identify genetic relationship. That is, you look at the DNA. That is, basically you're doing DNA fingerprinting. And after doing DNA fingerprinting, you're trying to compare and find out whether the DNA is of a particular person or not. And this DNA fingerprinting is used in forensic investigation and for species identification also. That is, in human DNA, we have 46 chromosomes, 23 pairs. So this is for humans. And for other animals, it's going to be different. So this helps us to identify different species also. And by actually comparing, after doing hybridization techniques, after doing DNA fingerprinting, after doing certain techniques like FISH and all, you'll be able to say whether it is of a particular person or not. You can use this genetic analysis even for paternity testing as well. So what are the 2 techniques? Morphological comparison. Then we have genetic analysis. We even have some other techniques. So what are those? Chemical profiling. So what do you understand by chemical profiling? Here, analyzing the chemical composition of substances to distinguish between different material of organism. So what are the chemical comparison that we do? Like for example, if you do a blood examination, you're looking at certain components, like for example, hemoglobin, RBC, WBC. So this proportion, what the actual range that is given for humans is going to be different from that is given for an animal. Or if you look at the bones of the human, the chemical composition of this bone of the human is going to be different from that of an animal. Maybe certain minerals are more in humans, whereas less in certain other animals. So this way you do the chemical profiling to do comparison to identify a particular species or a particular animal. Then we have behavioral analysis. observing and comparing behavioral patterns to identify individuals or species commonly used in ethology and psychology. So by looking at the person, like for example, usually, you just observe the behavior. Like a person who is mentally not that proper, not well, he might be wandering here and there. He might have repetitive thoughts. Like for example, if you look at a person of, a mania, he may not, just sit in a particular place. He might be wandering around, moving around, doing multiple things, no? Or a person with depression might be sitting in a corner, not wanting to mingle with anyone, low interest, anhedonia, no interest in anything. So by looking at how the person is behaving, or if you look at a thief, he might look very suspicious, or a police, he might be very vigilant. So by looking at the behavior of these people, you'll be able to say what kind of profession they belong to, or what they might be suffering from. That is a behavioral analysis for identification. Then we have statistical methods, that is utilizing statistical models to compare databases, identifying significant differences or similarities among groups. That is, you take a lot of data from people, you do a statistical analysis to find out certain similarities that fit them in a certain category, or dissimilarities that will take them away from that category. So coming to this question, what are the different things that which are the comparative techniques? Number one, morphological comparison. Then we have genetic analysis. Then we have chemical profiling. Then we have behavioral analysis. And the last one is statistical method. Okay, so this is a little difficult question, I might rather say. So if you have just mentioned these terms also, you're going to get good marks. If you can write 1 or 2 points about these, more good for you. There are also two more things, which are the linguistic analysis and the image comparison. So what is a linguistic analysis? Comparing language patterns, syntax. Syntax is how they spell, the accent of the person, the vocabulary to identify authorship or language origins. Like, for example, a person from the US might have a different type of accent. A person from Australia, a person from Asia, everybody has a different accent. No? Even in India also, the way people in North India speak Hindi is very different from the way how South Indians speak Hindi. So by looking at the syntax and the accent, you can do a linguistic analysis and segregate people. That is also a technique for identification. Then we have image comparison, where by using digital tools, we can compare visual images for identification purpose, such as forensic imaging and species classification. We also have that X-ray negative superimposition. So I'll be discussing about this question also later. So this is one of the digital tools to compare visual images of the dead person. If you have a photo with that of a skull that is available, so if there are a lot of similarities between both, you can say that the skull is of the particular person. So you're going to zoom in both, and you're going to give specific coordinates here. It's a big thing. It's a little complicated, yet a very interesting topic. We'll be discussing about that in the further classes. Okay. So what are the different types of comparing techniques available for identification? Repeat after me. Morphological comparison, genetic analysis, chemical profiling, behavioral analysis, statistical methods, linguistic analysis, as well as image comparison. Now coming to the third question, tattoo marks, and mention the dice used to produce tattoo marks and the different techniques used for eraser. So if this is a 3-mark question, look at the question. Okay, the question is divided into 3 parts. Firstly, they're asking you about tattoo marks. So you have to generally describe or tell what a tattoo mark is. Then they're asking, mention the dice used to produce tattoo. So that is the second part of the question. So you are going to explain about the different dice. Then the third part is about different techniques used for eraser of the tattoo, which is the third part. So this is a 3-marker question. Each part of the question is going to carry a mark each. Therefore, for each part, you're going to write 2 or 3 points. That is how you're going to score the entire 3-mark. Coming to the first part, tattoo marks. These are nothing but the design which are imprinted on the skin by multiple small puncture wounds with needles or an electrical vibrator dipped in a coloring matter. That is usually in the present day. In the olden days, what would happen? They take small needles and then just to make small puncture wounds on the skin, okay, and that would produce a tattoo. But now we have vibrators which can be dipped in different coloring matter. Therefore, we can produce different color tattoo. Before, if you see olden people like grannies, grandpas, having tattoos, usually that pale greenish black tattoo. But presently, you have blue, red, all the colors that are available because of the different dyes people use. Now coming to what are the different dyes used, we have India ink, we have cinnabar, vermilion, chromic acid, indigo, and Prussian blue. So these are the commonly available dyes that are used in order to produce tattoo. So usually what happens is all these tattoos are permanent in nature. Why? Because they are, see, we have epidermis, which is a superficial layer of the skin. Then underneath we have the dermis. So whenever a tattoo is caused, the ink or the needle is going to penetrate till the dermis. Therefore, it becomes a relatively permanent picture. Marks are recognized even in the decomposed body when epidermis is removed. That is, as I told you, it is there, the tattoo mark or the ink is there in the dermis, no? Therefore, when you peel off the epidermis also, you are able to see all these tattoo marks. Lymph node near the tattoo show deposit of the pigment, because wherever there's lymph node, you know what happens? These tattoo, the ink is going to penetrate to the nearby structures and it is going to go near the lymph node also. Therefore, you can see the pigment in the lymph node as well. Now we have understood what a tattoo is, and we have also seen what are the different dyes used. What are the different dyes used? Try to recall, name one or two. Vermilion, cinnabar, then we have chromic acid, then we have indigo and Prussian blue. And what is the other one? India ink. Okay, so what are the easiest one? India ink, because we are in India. India ink. Okay, then indigo. What is indigo? Indigo, India was very famous for growing indigo, and British would export indigo like anything. So indigo is blue in color. So remember one more pigment which is blue in color, Prussian blue. So all these have to do something with blue. Then we have vermilion, then we have, which is red in color, then we have cinnabar and chromic acid. Okay. Then now coming to the eraser, we can use a surgical method for eraser, where we can do complete excision and skin grafting, or carbon dioxide snow can also be used. So complete excision is wherever tattoo is there, you're going to completely remove that portion of this dermis and the epidermis. That is completely excising or removing. And then skin grafting. That is, after you remove everything, you're going to take normal skin from elsewhere and you're going to graft that skin on the part where you have excised. Or you can do carbon dioxide snow. When you use carbon dioxide snow, that is going to permanently disfigure the part where there was tattoo. So though nobody is going to get to know that there was a tattoo. Okay. You can do electrolysis. You can also use caustic substances, where you can use caustic acids or even caustic alkalis in order to remove the tattoo. You can also use laser beam. This laser beam is one of the most modern, safest, and the easily accessible method that is used in order to remove the tattoo marks. Okay. Now, what are the medical legal importance of tattoo? By looking at the tattoo, you can either get to know the identity of a person, you can get to know the religion, god of worship. Like, for example, if a person has a tattoo of Hanuman, that means he is a Hindu. Or if the person has a cross, that means he is a Christian. So this way, we will be able to identify what is the god of worship and therefore the religion of the person. Culture and lifestyle. For example, a person who likes to travel might just put a wave, or might put stars. So these, by looking at all these, or might put mountains, you can say that the person was into traveling. Or if he has some other drinking or something related to that, or if he has something related to fashion, that tells about the lifestyle of the person. If there are some indecent figures of perversion that is present on the as a tattoo mark, it indicates that the person was perverted. Okay, and also there could be tattoos related to travel, history, war, and occupation. Like, for example, if a person puts the doctor symbol with the snake, then that means that the person is a doctor. So by looking at or he might even put a plus. So by looking at all this, you can say what the occupation of a person was. Gang members. So there are certain illicit drug users who are like a gang. These people, everybody from the gang, or there might be some people who are smugglers as a gang, or people who are abductors of small children or women as a gang. And usually all these people have similar tattoo marks, and when they look, it can be there either in the area between the thumb and the index finger, or it could be there on their tongue. So when they see another person, they're going to show their tongue, and if they have the same tattoo, they're going to identify that the member is from the same gang. Or homosexuals also might have a particular type of tattoo. So by looking at all these tattoos as a forensic medicine expert or as a RMO, you should be knowing about different type of tattoo and what they signify. That way it will be easier for you to recognize a person. Coming to the next question, cephalic index. So this question, cephalic index, not only comes for you as a 3-marker, can also come for you as a Viva OC and as a practical question also. And in your practical also, you should be able to find out based on, by looking at the skull, the cephalic index, and gauge whether the race is Aryan or a European or a Mongolian. Okay, the cephalic index is something that you have to know, and it can come as an MCQ also, even in your NEET later. Okay, so what is cephalic index? It is the ratio of the maximum breadth of the skull. Remember, B comes before L, no? It's B, alphabet B, which comes before L. Therefore, maximum breadth divided by maximum length of the skull divided into 100. This gives you cephalic index. So, if the cephalic index is between 70 to 75, it is called as dolichocephalic, that is long-headed. Remember, how does a doll look like? It's going to be a long doll. No, it's going to be tall, long-headed, dolichocephalic. So, what race comes under dolichocephalic? You have the pure Aryans, you have the Aborigines, and the Negroes, which come under dolichocephalic. Then you have mesocephalic, which are the medium-headed. How to remember this? Medium. Mesety, M for M, medium-headed people, the mesocephalic, coming from 75 to 80. So remember that all these cephalic index are going to start from 70 and 5, you have to add 5, 70 to 75, 75 to 80, 80 to 85. So the middle, 75 to 80, comes under medium-headed or the mesocephalic. And who are here? The medium-headed people, Europeans and the Chinese. Then we have the last one, short-headed or the brachycephalic, which has a cephalic index of 80 to 85. And who comes here? It is the Mongolians. Now, the question, Indians, where do we fall? Indians, remember, we fall in the medium-headed people or the mesocephalic, along with Europeans or Chinese. So what is the medium-headed people cephalic index? 75 to 80. Got it? So this is what you have to remember about the cephalic index. Coming to the next question, medical legal aspect of age. So you have to know the significance of each and every age. Number 1, criminal responsibility. Any act done by a child less than 7 years is not considered as an offense. Okay, so because we believe that child less than 7 years, he is not aware of the action that he is doing. We believe that he doesn't know the implication of whatever he's doing. Therefore, we do not consider it as an offense. If the child is between 7 to 12 years, we look at the maturity of the understanding and then we judge whether he is criminally responsible or not. Because there might be people who are around 11 to 12 years, but they may not be able to understand what is happening again. Then they are not considered responsible. But if they are around 11 to 12 and they're able to understand the consequences of the action that they've done, then we consider them mature for punishment. Next, judicial punishment. The period of stay in juvenile home should not extend beyond the age of 18 years. Okay, so what happens usually if there are some children who are taken into custody and they are put into prison. Okay, the judicial punishment for such people is only up till they are 18 years. After 18 years, they should be withdrawn from the prison, or they should be left free from the prison. Sexual intercourse by man with a girl under 18 years, even if it is his own wife, even with consent, is considered as rape. Because as we saw the definition of rape is something where there is no consent. Usually rape, because in the definition, we say that there was no consent and with force. No? But remember that if the woman is less than 18 years, even if the person has been married to that woman, even if she is his wife, even if she's given consent, it is all considered as rape only. Next, kidnapping. Taking away a person by illegal means is called as kidnapping. If age of boys is under 16 years, and the girl is less than 18 years for the purpose of begging or procure a girl for prostitution. All these. So for boys, it should be less than 16 years, and for girls, it is less than 18 years. Then it comes under kidnapping. A child less than 14 years cannot be employed for any type of work. Okay. Now, even if a child has reached 14 years also, like 14 to 18 years, if they have to go and employ themselves somewhere for work, they have to produce a medical certificate or a physical fitness certificate stating that they are physically fit to undertake a particular work. And even after that, they have to be employed only under special circumstances. They should have only a fixed number of working hours, and they should be given specific number of leaves in their month. Okay. Attainment of majority is after 18 years. That is when they'll be allowed to vote, they'll be allowed to choose their leaders and so on. That is after 18 years. Evidence. Child of any age can give evidence. That is, even if it's a small child who is 5 to 7 years, can also go and give evidence. And remember, whenever they go to give evidence, if the child is less than 12 years, they do not have to take an oath also, because our law presumes that a child less than 12 years would not lie about anything. Marriage contract, female under 18 years and male under 21 years. So this is the age of marriage for female and men in India. So these are the legal responsibilities with each age, and this should be there in the tip of your tongue, because in your Viva Voce, they are going to ask all these. One more question. What is the age of retirement in a government office? It is 60 years. What is the age at which a person can appear for an election or for Rajya Sabha or Lok Sabha? It is 25 years. So these are the two extra things that you should know along with all that I mentioned above. Next, medical legal aspect of hair. What are the medical legal aspects of hair? In rape, pubic hair of the accused may be found on the victim and vice versa. So you can take that hair and you can do a DNA fingerprinting. So when you do the DNA fingerprinting, you'll be able to find who is the accused and who the victim is. You can match those. Stains on the hair indicate the nature of assault. Example, mud stain in struggle. So the hair can get dirty because of some certain substances that are there at the scene of crime, and that way we are able to identify what is the scene of crime. Nature of weapon based on injury to the hair or the hair bulb. Like for example, if there is if you do a microscopic examination, remember with a normal eye, with direct vision you can't see, but if it is a microscopic examination and if you can see to it that there is a clear cut, a clear slash in the hair bulb, that indicates that it was a sharp cutting weapon. So therefore, by looking at the injury to the hair and hair bulb, you can identify whether it was a sharp cutting weapon, or if it is just a ragged end of the hair that is seen, then that you can say that it was not a sharp cutting weapon. Okay, like for example, it could be a blunt weapon. Hair, as I told you, it can be used for the purpose of identification. You can do DNA fingerprinting and identify the person. Sex and blood group determination can also be done. Singeing of the hair, whenever there is an injury from burn, there's going to be that the tangled, breakable, with a peculiar smell in the hair, which is called as singeing of the hair, and it indicates that it is a burn injury. Heavy metal poisoning like arsenic can be detected in hair. So remember that in certain metal poisoning, certain heavy metal poisoning like that of arsenic, you can detect the smell of arsenic from the hair also. And when you do certain chemical examination, you can detect arsenic in the hair. So these are the medical legal importance of hair. Coming to the next question, corpus delicti. What do you understand by corpus delicti? The body of the offense or the essence of crime. So this corpus delicti is nothing but it is the essence. The most important thing of crime is called as corpus delicti. So we look at what is the most important thing in a crime. For example, in a homicidal death, body of the victim and other facts which are conclusive of death by foul play, like bullet, knife, etc. So if I am a forensic expert or a police, so I'm going to go to the scene of crime whenever I get intimation saying that there is a foul play involved or somebody has been injured or killed. Now, when I go there, everything that I see in the scene of crime, what do I see in the scene of crime? There's a body of the person. There might be his clothes that are lying around. There might be the weapon that caused injury lying around. So everything that is there around him, okay, is called as corpus delicti. And what is the essence of corpus delicti? We can identify the person with the help of the different evidence that we get from the place. We can identify the accused as well. The main part of corpus delicti is to establish the identity of the dead body and infliction of the violence by person charged with crime and none other. That is, this corpus delicti is basically giving us an opportunity, per se, I can say, to identify the person properly. Like I'm going to link, it acts as a link between the scene of crime and the person. Link between accused. So accused, usually he'll be there in the scene of crime, and the victim. So there might be certain things in the victim. There might be mud from the scene of crime in the victim's shoes, or there might be tire marks of the accused person where the victim was found. So these are all the things that will help us in finding who the victim and accused was. So all the essence of all this is called as corpus delicti. Coming to the next question, age estimation of the teeth by Gustafson's method. So Gustafson's method is a method which is used to estimate the age in people, especially adults who are about 21 years. Okay, and we do this by looking at various changes in the dental tissue. So we'll look at what are these changes. Okay, this also, remember, there are 6 changes, and these 6 changes also should be there on the tip of your tongue, and this is a 5-star question. That means you have to know it no matter what. It will come in your theory, it will come in your practicals, in your Viva OC, in your MCQ, everywhere. Number 1, attrition. That is wear and tear due to mastication. That is whenever you are continuously involved in chewing, there can be wear and tear in the teeth, especially the upper surface of the tooth is destroyed gradually. So I have an image for you also to understand attrition. Okay. So if you look at the teeth, no, this upper surface of the teeth which undergoes wear and tear because of the process of mastication is called as attrition. Next, we have periodontosis, that is regression of the gums and the periodontal tissue surrounding the teeth with advanced age. That is, if this is the teeth, we have the gums that are there under the teeth. No, this undergoes regression. That is, it is going to go down. There is going to be regression of the periodontal that's surrounding the teeth. There are certain tissue which will undergo regression, and this is called as periodontosis. That is here. This part, wherever the gum is there, no, this is undergoing regression. This is called as periodontosis. Got it? Coming to the next change, we have secondary dentine. That is, it is going to develop from the walls within the pulp cavity and reduce the size of the cavity. Later can completely fill the pulp cavity. So basically, if you see a the secondary dentine deposition, what happens? So now I'll be marking it in green color. Okay, so this is the teeth. Then you have the pulp cavity in the center. So what happens from the teeth inside the pulp cavity, wherever it is there, no, secondary dentin starts depositing. And when the secondary dentin starts depositing, the pulp size of the teeth reduces significantly. So this is called as secondary dentine deposition. So coming to the next change, we have cementum apposition. That is, secondary cementum slowly and continuously deposits throughout life, forms incremental lines. So whenever there is secondary cement deposition, these are seen on the enamel as cross striations, and these are going to be seen like these I'll be marking it in blue color, these cross striations that are seen in the teeth because of cementum deposition. This is the 4th change, which is called as cementum apposition. Then we have root resorption. Involves both cementum and the dentine, shows characteristic sharp grooves, start from the apex and extends upwards. So these are going to be seen. And then we also have transparency of the root. And transparency, remember, it is seen only it is not seen up to 30 years of age. That is, only after the person is above 30 years, you can see this transparency. Okay, and this transparency occurs from below upwards in the lower jaw and from above downwards in the upper jaw. And this transparency of the teeth is the most reliable sign. So in your MCQ or in your Viva, they might ask you, what is the most reliable of all the criteria that is there in the Gustafson's method? Remember, it is transparency of the root that starts only after the person is 30 years. So what are the various changes that you see in Gustafson's method? Attrition, periodontosis, secondary dentine, cementum apposition, root resorption, and transparency. Okay, coming to the last question for today, Klinefelter syndrome. Klinefelter syndrome is a genetic condition affecting males characterized by the presence of extra X chromosome. Okay, so Klinefelter syndrome, remember that is going to be seen in male. That is number 1. Okay, and here they have extra X chromosome, 47XXY. Usually the men, they have 46XY, no? But in Klinefelter syndrome, they're going to have 1 extra X, yet 47XXY. Okay, so let us look at certain points for Klinefelter syndrome. Klinefelter syndrome is caused by non-disjunction during meiosis, leading to presence of 1 or more extra X chromosomes. Okay, so usually during meiosis, there should be a disjunction of the chromosome, because of which there is a reductional division taking place. But if it fails to happen, there is going to be non-disjunction, leading to an extra X chromosome in the males. Coming to the physical characteristics in this people, the common physical features may include taller stature. So these men are going to be usually very tall, they have less muscle tone, and they have gynecomastia. That is, they have breast development, which is seen. Hormonal imbalances. Individuals often have lower levels of testosterone, so because of which there will be delayed puberty, as well as the person might be infertile. These people can also have cognitive and learning challenges. Many affected individuals experience mild learning disabilities and may have difficulties with language and execution function. So these people, you can say that these people are a little dumb, okay, because these people have certain language and intellectual and cognitive challenges, difficulties. What are the other points? How do you diagnose these people? Diagnosis typically occurs through karyotype analysis, which identify the chromosome pattern. So once you get to know that they are 47XXY, when you do karyotyping, you can say that these people have Klinefelter syndrome, and you can confirm it by doing the genetic testing. How do you manage these people? Treatment options include hormone replacement therapy, where you give these people with testosterone. You also assist them with fertility, and you educate and address their learning difficulties. Early intervention can improve outcomes significantly. Okay, so these are the different points about Klinefelter syndrome. Remember, three main important things seen in men: 47XXY, extra X chromosome causes non-disjunction during meiosis. And then they have learning difficulties, they have tall stature, less muscle tone, decreased testosterone, therefore gynecomastia, delayed puberty, infertility. So these are the things that you have to remember. Now coming to the MCQs, first MCQ. So this is a relatively very easy MCQ. So I want all of you to give me answer fat, okay? Number one question, dactylography is a study of what? We have discussed. Let's see the option: handwriting, fingerprint, fossil, eye movement. What is the answer? The answer is obviously option number B, fingerprints. The study of fingerprint is called as dactylography. It is also called as dactyloscopy or the Henry Galton system. So whatever they give, it is same. Okay. Coming to the next question, the next MCQ is, what is the primary forensic significance of tattoo marks? So the question is about tattoo marks. Let's look at the option: identifying a suspect or victim, determining the cause of death, estimation of time since death, identifying a weapon used in the crime. What is the answer? Is it to determine the cause of death? No. By looking at tattoo mark, you cannot tell the cause of death. Estimate time since death? No. For this, you see the rigor mortis, you see the livor mortis. You look at all these and say the time since death. And if find the weapon used? No. By that also you can't do with finger tattoo marks. So what is the use of tattoo marks? Option number A, to identify a suspect or a victim. Coming to the next question, the cephalic index is primarily used to determine what? So first of all, what is cephalic index? That is the maximum breadth of the skull divided by maximal length of the skull into 100. So it is from 70 to 75, 75 to 80, and 80 to 85. So firstly, we have dolichocephalic, then we have meseticephalic, then lastly we have, what do we have? We have the brachycephalic. So these are the different things. So the cephalic index is primarily used to determine dash. Let's look at the option. The blood type of individual? No. Shape of skull? Could be. See the height of individual? No. With skull? No, you can't do. The age of skeleton? No. So what is the right answer for this question? The right answer for this question is option number B, the shape of skull. Now tell me, where do Indians belong? Either they are dolichocephalic, or they meseticephalic, or are they brachycephalic? The right option is they are the medium-headed people. It's nothing but meseticephalic. This is also something they'll ask you in Viva, so remember. Coming to the next question, what does the term corpus delicti refer to in forensic science? So they're asking you about corpus delicti. I told you, no, this is nothing but the essence or the important thing, the base, the heart of crime. Options: the body of the victim in the criminal case. Option B, the physical evidence proving a crime has occurred. Could be. Option C, the confession of a suspect. No, we are looking at the physical things here. So this is C is absolute wrong. D, the legal proceedings in the clinical trial. No, those are the procedure of court. So A, the body of victim in the criminal case. No, it is the other things, the surrounding things, whatever proves that the injury or the death has occurred. So the right answer is option number B, the physical evidence proving crime has occurred. So this physical evidence, which is the essence of the crime, is called as corpus delicti. Now coming to the last MCQ of today. Gustafson's method of age estimation is primarily based on dash. It is also an easy question. Option A, bone density analysis. No. Changes in the teeth? Yes, could be. Let's see the other options as well. Skull sutures? No. Length of long bones? No. So what is the right answer? Changes in the teeth. That is option number B is the right answer. So this Gustafson's method can be used to all those people's age estimations about 21 years. And what is the most important thing in Gustafson's method? That is transparency of the teeth, usually above 30 years, seen only above 30 years. So how many points are there? There are 6 points. So you have root resorption, you have periodontosis, you have attrition, you have transparency, secondary dentin deposition, as well as cementum apposition. Okay. So I hope you all enjoy the class. So these are the very important topics that will come from the chapter of identification in your exam. So remember, mostly it's all the short answers that come. So even though the chapter is very big, doesn't have that much weightage. So study accordingly. Thanks for watching. I'll see you all with one more interesting chapter and important questions. Thank you.